Today, I'm going to talk about opioid abuse, which is a major public health crisis affecting many lives in our society. We will explore the nature of the substance, its history, prevalence, associated risk factors, side effects, signs of abuse, and how we can structure care for those affected. Let's delve into this timely and critical issue. Opioids are a class of drugs that act on the body's opioid receptors to produce effects like pain relief, euphoria. They include both prescription medications such as oxycodone, hydrocodone, as well as illegal drugs like heroin and synthetic opioids like fentanyl. While they are effective for pain management, they also carry a significant risk for abuse and dependence, which often leads to addiction. Historically, opioids have been used for thousands of years, with records of their use dating back to the ancient societies in Mesopotamia and Egypt. However, the isolated compound morphine was first introduced in the early 19th century. The late 20th century saw a sharp increase in the prescription of opioids, especially in the 1990s when pharmaceutical companies promoted their safety and low addiction potential. This led to widespread of misuse, giving rise to what we now call opioid epidemic. Statistics from the CDC shows that over 70,000 drug overdose deaths were recorded in the United States in 2021. With opioids involved in nearly 75% of this death, prescription opioid sales quadrupled 1999 to 2010, creating an environment ripe for misuse. The opioid crisis affects a wide demographic, but particularly middle aged adults and residents of rural areas where access to treatment is often limited. Risk factors for opioid abuse include a history of substance abuse, mental health disorders such as anxiety or depression, and chronic pain conditions. Vulnerable population include individuals who have easy access to prescription medications, young adults, and those with socioeconomic challenges. Understanding these risk factors is crucial for identifying and helping those who may be at risk. Short term effects of opioids use include feeling of euphoria, sedation, and effective pain relief. However, they can also lead to negative physical effects such as nausea, constipation, and severe respiratory depression. The long term opioid use often leads or results in tolerance, dependence, and significant changes to the brain chemistry, leading to heightened risk of overdose and addiction. When assessing for opioid abuse, clinicians should look for physical signs such as constricted pupil, slurred speech, and drowsiness. Behavioral indicators may include secrecy, withdrawal from social situations, and marked changes in work or school performance. Recognizing these signs early can facilitate timely intervention to prevent further harm. The potential for overdose is a critical concern in opioid use. Overdose can result in respiratory failure and death, particularly when opioids are combined with other depressants like alcohol or benzodiazepines. Moreover, opioids are frequently used as a means of suicide due to their accessibility and lethality, making it, making it imperative for healthcare providers to understand the risk. A comprehensive care plan is essential for managing opioid abuse. Start with pharmacological treatment, which could include opioid agonist therapies such as methadone, buprenorphine, along with prescribing naloxone for overdose reversal. Non pharmacological treatment like cognitive behavioral therapy and supportive group play a significant role as well. Patient education regarding the risk of opioid use and adherence to prescribed dosage is key. Referral to addiction specialists or mental health professionals may also be necessary, along with regular follow ups to monitor the patient's progress and adjust treatment as needed. In conclusion, opioid abuse is a significant public health issue that demands our attention and action. Understanding its complexities, recognizing the associated risks, and implementing effective care strategies can help mitigate its impact. As further healthcare professionals, we have a responsibility to advocate for and support those struggling with opioid addiction. Thank you for listening, and I welcome any questions or discussion.